Hey everyone, welcome back to Staying Connected, a podcast where I talk to other people about their stories with Vascular Ehlers-Danlos Syndrome, or VEDS. This is Katie, your host, and today I have Rebecca with us to share her story with VEDS. Hey Rebecca.
Hey Katie.
Thank you so much for doing this interview. I'm really excited to have you share your story.
Absolutely. Thanks for having me.
So when were you diagnosed with VEDS?
I was diagnosed at the end of 2016. I had had several major medical events before that, but in 2016, we moved to Boston, and in getting established with doctors there, that's when I met docs who kind of for the first time knew about VEDS and pretty much immediately tested me. And of course, I came back positive.
So what were some of those medical events? I know you had a complicated history prior to this, right?
I did. I kind of had three pretty major medical events. When I was 18, I had a renal artery dissection. It presented as very high blood pressure when I went to donate blood at high school in the high school blood drive. And we didn't really have a great reason why that happened, but I recovered well. And to be honest, I was a senior in high school, and I was mostly concerned about, whether I would miss college band auditions and how bad my bruising was and when I could go to the lake with my friends, so it was one of these weird things that happened, but I recovered and moved on. And then right before my 21st birthday in college, I had my first heart attack, which we now know was probably a dissection of the coronary artery, or SCAD, spontaneous coronary artery dissection. Mm-hmm. And again, it was one of these, that was just this like huge, crazy medical thing. And in retrospect, somebody in medicine probably should have tried to connect these two things, but there wasn't an obvious connection. And again, for me, I was 21, I was in college, I was focused on getting back to running. I ran a lot at that point and applying to grad school. So I think I was kind of in this mindset of, okay, like this happened, this was not good, but I got to move on. And I did, and eventually it kind of became this weird thing in my medical history. And my husband's in the military, so every time we moved and I saw new doctors, I was this healthy girl in my 20s with these two weird medical things in my history, but I was stable. So nobody really spent a lot of time looking into it because we didn't really need to. And then I had two relatively uneventful pregnancies, both monitored heavily just because of my history. And we really thought that was that. And then in 2015, I was 6 months postpartum with my youngest, and I had another dissection of my coronary artery, another SCAD heart attack. And that one also caused cardiac arrest when I was out running with some friends. And fortunately, I was with friends, and these amazing women did CPR and kept me alive. And I spent most of the rest of 2015 kind of in and out of the hospital with complications from that. And, it was tricky because survival of out-of-hospital cardiac arrest is pretty low. It's about 5 to 10% chance of survival, not even among vets, just among the general population. And so the fact that I survived, complications were expected. I had lots of weird things. My defibrillator would perforate. I'd have, things that weren't expected, but we were really just trying to put out the fires then.
So you have an implanted defibrillator?
I do. And, I finally got stable, and we did start looking for underlying causes throughout that. Everybody at that point, I think, was ready to say, okay, this is no longer, all random things. But then in 2016, we had the opportunity to move to Boston. And so as we moved there and I was getting established with a medical team there, I think kind of two things came to be. One, I was we weren't putting out fires anymore. It was stable. We were able to really look at my medical history. And two, Boston is just such a medical research center that, it was like once I met cardiologists that knew about VEDS, I think I learned about VEDS, and in that same week had cardiologists say, why have you not been tested for this? We need to do it. I'm pretty sure this is it. And so at that point, we were able to diagnose it.
Yeah. What did going through that feel like? Like for somebody to meet you and say, hey, we need to test you for this rare condition. Had you ever heard of it before?
No. So I had it was pretty wild. First of all, I'm still seeing these docs, this group in Boston, and just amazing medical providers. In terms of knowing my history and really being prepared for visits, it's just awesome to walk into a clinic visit and, the doctors are like, okay, we've reviewed your history and already have some ideas.
Yeah.
And for me, certainly, and I think for a lot of us, certainly getting that diagnosis is scary, terrifying even, but to another extent, I had already had all these major complications. So it's also kind of putting a name to it, making a plan.
Yeah. So prior to this, you had already had a renal artery dissection and a heart attack that was
Coronary
probably
artery.
a dissection.
Yep.
Yeah. And then a cardiac arrest with an implanted defibrillator.
Right. And so I always laugh at them like, I'm super healthy except for like these crazy things.
Yeah. Wow.
Yeah. So I had those, and I think at that point, we really were still diagnosing most of these things as bad luck. And certainly that, I'm sure there is some of that involved, but, when your diagnosis is bad luck, then your like management plan is cross your fingers and hope for good luck. And so, so for me, there was also that little bit of relief of like, okay, now we actually have something that we can put our finger on and something that'll guide management. We're not just throwing our, making wild guesses. We're at least, going based on something.
Yeah. And so since your diagnosis, have you had any complications or anything? Like how has your like daily life changed, if at all?
So not any major complications. I've had, a defibrillator replacement that went really well, actually. My first one that didn't have complications. But aside from that, I've done really well medically. Certainly life changing from that. I think there's a perspective shift for sure. I think all of us on this earth, we don't know how long we have physically on the earth. Like we don't know day to day. Nothing is guaranteed. But I think to some extent, most of us are able to not really think about that in our 30s. And I think having the diagnosis for sure really made, me examine that and really be trying to be very deliberate about what we do, what I do each day, what I want to be part of, what I say yes to, what I say no to.
Yeah, it's a big thing. It's hard to deal with and try to balance that, I think.
Mm-hmm. Well, and like, for example, at the very beginning, I had been looking for a part-time job just because my kids were little, but I had accepted a full-time position. And then right after diagnosis, it was like, made me realize like, no, like I'm not willing to make, this is one compromise I'm not willing to make. I will, need to be part-time. And certainly different people have different thresholds on that. But I think for me, really highlighted like, okay, what are the things that I really, really need and want, and the time to do them is now.
Yeah. So you're in the medical profession, right?
I am. I'm a PA, or physician assistant in pediatric primary care.
Very cool. How has that impacted, does that impact your thought processes at all, you think?
Absolutely. I think it, certainly having the VEDS diagnosis affects me as a clinician. I think really, really, truly understanding what people are navigating and going through. So many people are going through tough things, and I think I, intimately understand how moments and diagnoses and support stick with people, and helping patients and families navigate that. I think it also really helps me with the uncertainty of VEDS. I know a lot of us with VEDS can be frustrated with like the diagnostic odyssey and just some of the frustrations with that. But I think I also know medical training. In medical training, we learn so much, but we can't possibly know everything about everything. And so I think I appreciate that I have that perspective in terms of, every clinician cannot know everything about a rare diagnosis. The fact is, for me as a patient, this is a really, really big thing. But it is, in the huge medical world, it is a rare diagnosis. It is a rare disease. Mm-hmm. So I think, it really highlights the importance of a medical team, having, great doctors who work together.
Oh, yeah. Yeah, I think that can make all the difference in the world.
Oh, absolutely. I think, for me, it just gives me a lot of hope and reassurance to know that I have, my medical team that will take care of me. And for example, when I had this defibrillator replacement a little bit unexpectedly this past fall, just knowing okay, my cardiologist knows who I am. My PC is watching out, making sure everybody's connected and what we need to do to be prepared for this procedure. And that's really reassuring, as a patient.
Yeah, for sure. Definitely. So you have 2 kids, right? I
do. They are 6 and 9.
And do they have VEDS?
They do not, fortunately. We did decide to have them tested. I know, different people make different decisions about that, but just given my medical history as far as medical events, along with the diagnosis of VEDS, we kind of knew that they would be treated as if they had VEDS regardless until we could prove otherwise. So we did go ahead and test them. We're very, very thankful that we're both negative.
Oh, that's so great to hear.
Definitely. Definitely. It was a huge relief,
Yeah, that has to be. How did you guys celebrate that moment? Do they know that they were being tested for something really scary?
So no, they were still, they must have been 2.5 and 5. And so we, with me being in medicine too, we're pretty open about, talking about what we're checking for. And, we're looking to, do your checkup. Everybody's body's different. And so we knew they knew they were getting their blood drawn, of course, and, we were checking up on their heart. I think at first it was disbelief. There was kind of some suspicion that one of them, just based on clinical features, was possibly positive, and so we had kind of mentally prepared ourselves for that.
Yeah.
But I think one of the things that kind of helps me, and I'm certainly a logic doer type person, so this may not apply to everybody, but for me, I really kept thinking with them, it already is or isn't. Their DNA is already set. What we're doing is we're simply finding out. Mm-hmm. To be able to make decisions, going forward.
Yeah.
So I think it helps with that, but it certainly didn't take away the fact that it was a scary month. But we were very, very grateful, of course.
Congratulations. Are you the first in your family?
I am. Nobody else have been diagnosed, and since my diagnosis, both of my sisters have been tested and were negative. And that again, just huge relief. I think that was one of my big concerns, to be honest, for me, being that it's a genetic, disorder. For me, I had already had these medical things, so it was finding some explanation. Mm-hmm. Whereas my kids and my sisters are healthy and living their life and doing their thing, and realizing, I think it was kind of having that conversation of okay, guys, this is not just Rebecca's crazy medical thing. This could affect you too.
Yeah. How did you deal with that as a family? Because I know I've heard from some people that they have problems getting their family to either take it seriously or even want to get tested. Were they pretty receptive to it, or how did you communicate?
My sisters definitely, I think, were. It's tough. It is. I completely sympathize, because it's such a big decision to get tested and to pursue that. We were really fortunate just in the workup of my kids. Again, being in Boston, we met with, not only cardiology, but psychology and social work, and a whole team to kind of help my husband and I think through what will we do with this information? How will this have an impact? And honestly, I think those discussions not only helped us in terms of thinking about testing our children, but also in terms of me understanding a little bit more about what my family members would be thinking about. Mm-hmm. And both my sisters were interested in getting tested. And so they went ahead and pursued that. My parents haven't. And again, it's personal for everybody, but I definitely, can understand they talked with their physician about it and thinking about their age and medical history and, decided not to pursue it. But again, it definitely a relief, finding out once I knew that all four, both my sisters and both my kids were negative, to kind of know, okay, it stops here.
Yeah. That has to be a huge relief. For
Definitely.
Sure. So I want to go back because I think I heard something at the beginning of this interview, and I want to go back to it, if that's okay.
Yeah, absolutely.
Okay, so you mentioned that your first renal artery dissection showed up as kind of like this hypertension event. Was it during a blood draw or after a blood draw? Was it caused by the blood draw?
Yeah, so I went to donate blood. We were having just a high school blood drive, and I went to donate blood, and one of the things they do is take your blood pressure before doing that, and my blood pressure was sky high, and as a very fit, active, thin high schooler, it was pretty surprising, and so I wasn't able to give blood. We went to see my primary care provider that afternoon, and they pretty quickly came to something with the renal artery. And, we now believe, I call it a renal artery dissection because that's, what we now believe it probably was. At the time, we were just calling it a renal artery stenosis or some sort of blockage of the renal artery. Not frequently, but, because that's not something that frequently happens. But if you have a blockage of the renal artery in a young woman, FMD or fibromuscular dysplasia can be a cause of that. And so, for a little bit it was, maybe this was it. But again, it's one of those things that is all kind of guessing. To be honest, it was like, okay, well, this is as much of a construct as we can come up with. It's not going to impact what we do next. So, it was kind of, again, trying to find, okay, what could this be? Trying to make sense of things that were completely nonsensical, right? 18-year-old with this problem in the renal artery. Certainly in retro, it's always interesting thinking now, I can look back and it's like, oh, that makes so much sense. Like, but at the time, you have these weird medical things happening to somebody who otherwise has no clues for you. As a provider, I'm sure I can only imagine those doctors, trying to look at this like, what in the world?
Yeah. Do you have any outward signs of VEDS?
So definitely easy bruising. I always have very thin skin, bruise and bleed easily. We were talking about high school marching band, and I played the drums, and I remember always having bruises on my hips and my shoulders and everything. And, or playing volleyball in gym class. Oh, and it was one of those where it was just like, those were always...
Volleyball's rough on the wrist.
It is. I remember always just being completely bruised. But it was one of those things that it's like, okay, well, this just is what it is. And to other physical, the attached earlobes and kind of thin lips and some of those, when you look at it. But again, I think as all of us have found, you look at that list of kind of facial features and physical attributes. And I remember having this conversation with my sisters after I was diagnosed, like, do not just look at this list and completely freak out, because a lot of people can probably find a couple things on here. But the bruising definitely. And I still, it's always that question of, do I put a Band-Aid on this? Because I know that's going to rip my skin. But I think for a lot of it, I felt like, this is just how it is. I didn't think, okay, normal. This is super crazy. Right.
Yeah.
And I think sometimes that mindset can be protective. Other times I certainly have to stay and check that, I'm not simply avoiding feeling hard feelings, and dismissing that this can be really crazy.
Do you have any good coping strategies that you use for hard days?
Oh, that is like the grand life question, isn't it? But trying lots of things. I think it's something all of us are, hopefully working towards. I have a wonderful therapist who's just lovely, and some good friends that know the diagnosis and kind of understand just how multifactorial you're thinking about all these things, and like I'm thinking about parenting things, but in the back of my head, I also have this textbook life expectancy and all these other things that go in the back of your head. I think trying to stay grounded, trying to, keep up with, we as a family, we do our gratitude journal every day, and, connecting through faith and community and trying to stay active. I live in Connecticut now, so it's cold and hard to do that in the winter sometimes, but I think it always helps.
So now that you've had your diagnosis for, I guess, a little over 4 years, right? Almost 5 years?
Yeah, it's crazy to think about.
Yeah. So what's some advice that you would give somebody who's just receiving their diagnosis?
I think taking a breath, taking it slow, it's a lot to process. Again, I kind of think that it was already there, when you just get a diagnosis, we had VEDS our whole life. It's now that we know, and now we can make, appropriate plans and decisions going forward. Mm-hmm. And I think I know for me, that was protective and helpful, in kind of accepting that. And, of course, I put in my 2 cents on medical providers too. And I know it's frustrating, a lot of people right after diagnosis have this frustration about the journey, to diagnosis and how exhausting that is. But, medical providers are there to help, and, finding that right medical team. And once you do have that, it can be, it's so reassuring. It definitely just makes me feel a lot more confident in emergency planning, to have that in place.
Do you have any tips, like from the inside of the, you're in the medical community, like what kind of tips do you have for finding that care? And it's
still hard. Like when I first moved to Boston, I remember talking to one of my friends who's also in medicine and being like, because we didn't have any diagnosis for any of this at this point. And I'm like, I remember telling her, like, I just need somebody who's nice. Like I don't even know what specialty of cardiology I need right now. I just need somebody who's nice. Like, mm-hmm. But honestly, that's how kind of I got in. For me, since the majority of my events have been cardiovascular, we started with cardiology, and that's who tested me, and that kind of manages my care more or less. So my main cardiologist, there's a vascular surgeon that works with them, and so I kind of branch out from that essentially. And then one of my cardiologists recommended my PCP.
Nice.
And so I was, I feel fortunate that it came from there. And then my PCP does a really great job of just kind of connecting. I still remember being just in, shock after, and I think it was the end of like one of my first appointments with her. She's like, okay, so I'm going to, email everybody and make sure everybody's on the same page. And I just kind of looked at her like, oh my goodness, you're amazing. Like, that's awesome. Like, that's all we need.
That's probably why your cardiologist recommended her.
Yeah. Oh yeah. No, she's phenomenal. Like, nobody wants to commute to Boston, and and if she's ever taking new patients, like, grab her in a heartbeat.
That's wonderful. So really definitely. It's branching out from the expert that you have.
That's kind of where it worked with me is, we started with cardiology. That was kind of my most pressing need. That's kind of where I've been centered. I know, other people, have had more, bowel dissection, other parts of the body. So maybe, going from there.
Yeah.
I think that's probably also helpful just because being in cardiology, like, that was already such a tight connection to VEDS. That was who was already familiar with it. It's a genetic cardiac guy.
And I'm going to throw a plug in here. I think by the time that this episode is released on the last Sunday of March, the VEDS movement will have just done a webinar with Dr. Peter Byers on creating a care team for VEDS. So this is surprisingly relevant timing
Yes,
to have
perfect.
this conversation.
Perfect.
So if you're listening and you didn't catch that webinar, it'll probably be up by the time you're hearing this episode on thevedsmovement.org.
Awesome. Yeah, no, that is great, because I think it's something that kind of can come across as daunting, but again, I know I keep repeating this, but it really has provided me such reassurance.
Yeah, it's hard to get a good care team, but when you have one, it's incredible.
Oh, yeah. Oh, I told my husband, I said, no matter where we move next, I will be commuting to Boston for medical care.
I still do that to Seattle.
Yeah, but we'll be good. Visit friends, we'll be good.
That's wonderful. Is there anything else about your story that you want to share? Or did we catch everything?
I think that really kind of covered most of it. I really appreciate the VEDS movement. I think, getting that information together. I really appreciate you doing the podcast, and being able to, connect with other people with VEDS. It's interesting, because we each have journey seems like a kitschy word right now, but we each have this different journey of how things have progressed. But I think it's always reassuring to hear, and just know that we're not alone and other people are going through it. So
definitely,
I appreciate that.
Thank you so much. This podcast is really close to my heart. It's like I think I started it about a year after I was diagnosed, and I've been talking to people with VEDS ever since, and it has been a very healing experience for me, but also just meeting everybody, and just everybody is so incredible, and I just love this whole community so much. So I really appreciate that.
Oh, absolutely.
And I really appreciate you sharing your story too.
Yeah, thank you.
All right. Well, thank you, everybody, for listening. Thank you, Rebecca, for sharing your story again. If you haven't already subscribed to this podcast, go ahead and hit the subscribe button on your favorite podcast player. We have episodes on the last Sunday of every month, and we will see you soon.